Assalamu alaikum. I am Dr. Sania Asif, Assistant Professor in Anatomy Department. Today the topic is sternum. We will discuss it. There are mainly three parts of the sternum: manubrium, body of the sternum, and xiphoid process. Manubrium, as you can see here, this is the broad funnel shaped, and this is the body of sternum which is flattened, and the lower one is the xiphoid process. So we discussed three parts of the sternum: manubrium sterni, body of the sternum, and xiphoid process. Now, first we will discuss the manubrium sterni. Manubrium sterni superiorly have a notch which is known as jugular notch. On the lateral side of it, there is the clavicular notch. You can see here, which is deepened, and it forms the clavicular notch. Why it is here clavicular notch? Because the medial end of the clavicle will form sternoclavicular joint at the clavicular notch of the manubrium sterni. Then below the clavicular notch, there is the costal cartilage of the first rib, where the first rib will attach to the costal notches. So here is the first costal notch, then second, and up to the 7 costal notches you can see here. But in the manubrium sterni, you can see the first costal notch for the first rib. Then at the junction of the manubrium sterni and the body of the sternum, here is the sternal angle. It is very important because this can be palpable, and from here we do the counting of the ribs. At the level of the sternal angle, there is the second costal facet for the second rib. So when we are examining a patient in the ward or anywhere, we start counting ribs from here, from the second rib at the level of the sternal angle. So it is very important. Then we have the body of the sternum. You can see here the flattened structure, and on the lateral sides there are the costal notches. Then the last portion is the xiphoid process. It can be bifid or not. So firstly we have discussed the gross features. Then joints, as I told you, the sternoclavicular joint which form here at the clavicular notch. Then attachments. Mainly the pectoralis major and the sternocleidomastoid muscle have their attachments in the sternum. Mainly from the lateral side of the body of the sternum, there is the origin of the pectoralis major muscle. And from where sternocleidomastoid muscle will arise? It will arise from the lateral part of the manubrium sterni, just near to the clavicular notch. Now, we come to the clinical importance. Firstly, fractures. Fractures of the sternum are common as it is a subcutaneous bone and it is easily accessible. So, it can be fractured directly or indirectly in automobile accidents or in other cases. Second one is clinical feature is the biopsy. Biopsy can be taken, bone marrow biopsy, through the sternum as it is easily approachable. So this bone is used normally for the bone marrow biopsies. Number 3 clinical feature is the anomalies. Because it is can be receding or protruding. If it is projecting, then we call it as excavatum, and if it is receding, then we call it as I take it oppositely. If it is receding, then it is called as the excavatum, and if it is projecting, then it is known as carinatum or pigeon chest. This was all about the sternum. I hope you understood it. If there is any issue or any problem, you can tell me. Thank you.